Welcome back to our next episode of LCME and Me. We're talking about topics related to LCME accreditation, things that course and clerkship directors could benefit from. So today we're going to talk about required clinical experiences. And specifically, we're going to talk about how are required clinical experiences defined, how are they monitored, and that directly relates to the two elements that LCME has devoted to required clinical experiences. 6.2 talks about how they're defined, and 8.6 talks about how they're monitored. So let's first start with defining them. And the LCME expects us to define the experience itself. So is this a specific type of patient, a clinical condition, a procedure, the clinical setting where the student's going to get that experience, and then the level of student responsibility. And that third one's probably the most tricky. So let's unpack that a little bit. Importantly, the level of responsibility has to apply to all students. So there can't be different levels of responsibility that different students meet. There has to be one level of responsibility for all the students in the clerkship. For us, most of our RCEs have a level of responsibility of participate. And so that means that as the student is getting that experience, seeing that type of patient or that condition, they are involved in some way. They are taking the history from that patient, they're examining them, they're talking about the medical decision-making for that patient with the team, they're assisting with the procedure. They're somehow participating in the process with that clinical experience. And we do have a few RCEs where the level of responsibility is observed. And these are certain procedures in the surgery and OB-GYN clerkships. Okay, so think about the answer to this question. So who approves the list of required clinical experiences for each clerkship? And think about what you think the answer is. Is it A, the Assistant Dean for Clinical Education, B, the clerkship director, C, curriculum committee, D, the LCME, or E, the site director if the RCEs are different for each campus? I'll give you a second to think what you think the answer is. The answer is curriculum committee. That's who approves it. So as we're defining the list, the RCEs, really we should be approaching it with a mindset of what is essential for each clerkship, not just what is available. So it should not be, well, these are the things the student could experience, so we'll make these RCEs. But instead, these are the things that the student needs to experience or are essential for them to experience as part of this clerkship. And oftentimes that's based on some type of national standards, maybe published lists of experiences that are essential in that field or that align with expectations for graduation or for transition into residency. But that list of RCEs for each clerkship is developed by the clerkship directors and then formally approved by curriculum committee. So it starts with the clerkship directors, but the final approval process, as we just saw in that question, is the curriculum committee. So I can envision when the LCME comes, they could ask a question such as, how do you determine the list of RCEs for your clerkship? And so think about how you might answer that question. So as we think about these required clinical experiences that are essential in the clerkship, we can think about this as the clinical experiences that are expected of students. What would you expect the students to do in your clerkship? I would expect them to see a patient with this and this and this. You could also think about it as the clinical experiences that are required to pass the clerkship. You have to have experienced this and this and this in order to successfully pass. And that is two different ways to think about it, but really these should be the same thing. We need this, what is expected of them and what is required to be exactly the same. To borrow language from TV dramas where they're swearing in witnesses, the RCE list should be the list, the whole list, and nothing but the list. Meaning everything on that list is required and is expected of students. And there's nothing beyond that that's expected of students and nothing beyond that that's required. So students have to achieve the whole list, and the whole list is the complete list of everything that's expected and required. And the reason I'm emphasizing this is back in 2018, during our last review by the LCME, element 6.2, which is the one that talks about how RCEs are defined, was marked as unsatisfactory. And the LCME found that during the site visit, the clerkship directors told the survey team members that student participation in some procedures was mandatory, even though those procedures were not in the list of RCEs. And so that's an example where what's expected of students has to be exactly what's defined in the lists and what's required. Okay, so now let's talk about monitoring the RCEs. So the LCME does expect a system with central oversight that monitors and ensures completion. So think about the answers to these questions. So for individual students, how do they log the RCEs, and how are those monitored at the clerkship level? So students log their RCEs in Oasis, and how are they monitored? Well, in two ways. At the mid-clerkship feedback meeting with each student, their progress in completing the RCEs, how many they've experienced so far, are they on track, is discussed with each student. And also at the end of the clerkship, because these are required for completion of the clerkship, and so they have to be monitored to see if the student successfully completed the clerkship. And so I could also envision the LCME asking a question like this: how do you monitor completion of the RCEs within your clerkship? What about in aggregate? So looking at it beyond the clerkship level, but across all the clerkships in the third year in the application phase. So how does curriculum committee monitor it? Well, that happens in the QA process for each clerkship. So within each individual clerkship's quality assurance review, they look at how successful were the students in completing the RCEs. Are there any gaps? And then also across the entirety of third year, across all the clerkships, they're looking at RCE completion for the third year as a whole. And then that data is used to assess clinical resources. So particularly by reviewing the need for alternatives, if students are needing to use alternative experiences a lot, then that indicates that they're having trouble meeting the RC itself, and so that could indicate a clinical resource issue. Fortunately, we've not had much of that, but that's how we monitor to assess for clinical resources. So let's talk a little bit more about the alternatives. So we have our list of RCEs, but then we also have a list of alternative experiences. And these alternatives should really only be used if the actual RCE cannot be achieved. So they really should be a last resort. If at all possible, we want to get the actual RCE. And that may mean making creative adjustments. So it may mean, okay, the student hasn't gotten this experience yet. How could we get them this experience? Could we have them change teams next week? Could we have them go into this clinic for a certain day where they're more likely to see that experience? But we should be making adjustments to be able to get the students the actual RCE if at all possible, and then just use the alternative if all of that is exhausted. But the alternatives are an official list. So just like the official list of RCEs, it is a codified, defined list, and it's also developed by the clerkship directors and also approved by curriculum committee. And so finally, communication about the RCEs. So it's important that students know them and faculty and residents know them. So how do students know them? Well, they're included in the clerkship syllabus. So each clerkship syllabus lists, here's the RCEs that you need to achieve during the clerkship. They are also listed in Oasis, where the students go to log them. They can see the ones that they still need to complete. How do faculty and residents know these? Well, they are included in the clerkship guides that you send out 3 times a year that define key aspects of the clerkship, and that includes the RCEs for your clerkship. And then as you present to your faculty about student expectations for the clerkship, this is a great thing to include so that the faculty are reminded about the RCEs that the students should be on the lookout for, that they need to experience to successfully complete the clerkship. So in summary, the list of RCEs and the list of alternatives are both proposed by the clerkship directors and approved by curriculum committee. The level of responsibility for our RCEs is participate for almost all of them, except for a few procedures in which the level of responsibility is observed. The RCEs have to be a definitive list of required experiences. And so that comes back to the RCE list is the list, the whole list, and nothing but the list. And they are monitored by the clerkship at both the mid-clerkship feedback meeting and at clerkship completion. So hopefully this has been helpful to unpack RCEs and understand what the LCME's expectations are. I hope you'll join us at future episodes, and don't hesitate to reach out if I can answer any questions.